So good afternoon, everyone, and welcome to today's webinar, the 2020 Election, Public Health on the Ballots. Today's webinar is brought to you by the Network for Public Health Law, the Association of State and Territorial Health Officials, and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. We strongly encourage attendee participation, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your questions. Your moderator for today's webinar is Dawn Hunter. Dawn is a Deputy Director with the Network's Southeastern region, where she provides legal technical assistance and builds connections in many areas of public health law. Prior to joining the network, Dawn served in a variety of roles focused on public health, policy, and health equity. Dawn has worked in state public health at the New Mexico Department of Health, where she started as a Robert Wood Johnson Foundation visiting attorney in public health law through the network. She also served as the Director of Health Equity, Policy Director, and Deputy Cabinet Secretary. She'll be leading us through the rest of today's webinar, so Dawn, over to you.
Great, thank you. I'm really excited to bring you a dynamic conversation on the 2020 election and what that means for public health. Joining us today are Dr. Edward Ellinger, a former state health official from Minnesota, past president of ASO, and a current member of the ASO board. He chairs the HHS Secretary's Advisory Committee on Infant Mortality, provides coaching for the National Leadership Academy Public Health, and advocates for public health initiatives locally and nationally. He serves on multiple boards, one of which is the name of the foundation, which I tried to find how to pronounce online last night, and I couldn't, but I think it's Langelaw Foundation. He's on the board, and this year they've invested heavily in election security, voter engagement, and voter safety. We also have Dana Rice, assistant professor and public health practitioner and researcher, who examines best practices in public health leadership and community engagement. Her primary focus is on the integration of public health and correctional health systems and the impact of mass criminalization and mass incarceration on public health. And finally, we also have Rebecca Green, professor of the practice of law and co-director of the election law program, a joint project of the William & Mary Law School and the National Center for State Courts. Professor Green's interests focus on the intersection of privacy law and elections. She's also explored the use of alternative dispute resolution in elections processes. So the way today is going to work is this is a moderated discussion, no presentations. Professor Green is going to start us off, and we're going to talk about the election, health and safety concerns, and expectations for Election Day. With all that said, let's get started with Professor Green. Did you want to start us off with any opening remarks on what it means to hear today, voting in the middle of a pandemic?
Yeah, sure. I'm happy to start there. I think it's really unfortunate, obviously, that we find ourselves in these circumstances. But I think if there is a silver lining, it's that this pandemic hit far enough in advance of the general election that state administrators of elections have had a lot of time to prepare and plan for voting in a pandemic. And so I think that, I think we've seen in early voting, certainly, that lots of precautions are being taken to make sure that people have numerous ways of casting their ballot. Many states have expanded options for how to vote. And then for those who are voting earlier in person at polling places, there are lots of accommodations being made to ensure people's safety. So, it looks like historic turnout already. The early voting numbers are really significantly higher than previously. And so it doesn't look like a pandemic is stopping American voters from going to the polls.
One of the questions that people get, that we get, will election locations be enforcing COVID-19 measures, and what does that look like at the polling sites?
Yeah, this is a really interesting question, and I think a lot of voters are worried about safety issues. And so, as I mentioned, many voters who are worried about safety can choose to vote absentee, to vote by mail. I guess first I just want to say that I can't stress enough that people who are voting by mail, particularly those who are voting by mail for the first time, should take great care in filling out their absentee ballots correctly or their mail ballots correctly. This means carefully following the ballot instructions for absentee voting that you see included in your ballot packet. This can include your signature, an address, sometimes a witness requirement. It all depends on the laws of different states. Your state's official election website should have instructions, and there will, of course, be instructions included in the ballot packet. But what's happening is that a lot of ballots are being rejected, especially by first-time absentee voters, because they're neglecting to, follow instructions carefully. So I just wanted to sort of put in that plug to begin with. But if you can't vote by mail, or if you prefer to vote in person, election administrators are working overtime to ensure that voters feel safe voting in person. Voting should be no less dangerous than a trip to the grocery store. Potential issues can arise, particularly when people have to wait in long lines, especially for indoor portions of that wait. And so issues are coming up, what do you do if there are individuals who refuse to wear a mask or prefer not to wear a mask at polling places? And, there's some really hard questions there in terms of whether that could constitute voter intimidation or not. What used to be routine is so complicated this year as states sort of conduct elections in these circumstances. Some states like Virginia have mandatory mask requirements indoors. And that means that you don't have the option in Virginia to vote without a mask, as far as I'm aware. And there hasn't, I don't think, been any incidents here in Virginia, at least, on that question. But we have seen some really interesting twists around the country. So, for example, in Mississippi, the Secretary of State has assured voters who do not want to wear a mask that he will protect their voting rights or their right to vote. California election officials have responded to this problem by creating separate spaces available for voters who prefer not to wear a mask. So I think that example just shows you that, election officials are working really hard to respect the preferences where possible of voters and make sure that everyone can vote safely. So I think, it's going to take a little more doing this year, but I think there are plenty of ways that people can vote safely this election.
Can you specifically address whether masked voters should be accommodated in the polling place to be allowed to vote while not jeopardizing the health of other voters and the poll workers?
Yeah, I think this is really tough, right? Because as the Mississippi Secretary of State noted, if there is no official requirement that masks be worn, then people are, within their rights not to wear them. And of course, other voters might be concerned about their health and safety in that environment. And so I think the California approach of creating safe spaces for people to vote without a mask makes a lot of sense. But obviously that takes resources and planning to implement. So I don't expect, that to be available everywhere around the country. But I think that's a pretty creative way to address this issue by basically accommodating every voter depending on their preference. But, I do think this is going to be a source of tension, as Election Day approaches.
Great, and you did mention voter intimidation, and we saw a report here from Florida, where I'm based, of a police officer with Miami PD who showed up to vote in uniform, but also wearing a political campaign mask. And there was a lot of, there were a lot of Twitter experts who were talking about whether it was intimidation or whether it was electioneering, and concerns about how widespread things like that are. So could you kind of share your thoughts on, like, what is electioneering, is voter intimidation, what are the state laws around that?
Yeah, so it is illegal to intimidate, threaten, or coerce a person or attempt to do so for the purpose of interfering with that person's right to vote, or to vote as he may choose. It's illegal under federal law. It's a crime under federal law, and it's a crime under state law. State laws vary in terms of their formulations of this, but essentially voter intimidation is conduct that's intended to compel prospective voters to vote against their preferences or not to vote through activity that's reasonably calculated to instill fear. So some examples of prohibited activity include things like violent behavior inside or outside the polling site, confronting voters while wearing military-style or official-looking uniforms, brandishing firearms or the intimidating display of firearms, disrupting voting lines or blocking the entrance to polling places, following voters to, from, or within the polling place, verbal threats of violence, and so forth. And so I think, federal law and state law, prohibits basically any activity that will interfere with someone's right to vote. If you, find yourself in a context where you think this is happening, obviously if you fear imminent violence, you should call 911. But in absence of imminent harm, the best thing to do is to notify the local election official at your polling place, and also document what you see or experience in sort of as much detail as you can, what happened, where, when, whether any voters were deterred from voting. And then there'll be a lot of voter protection advocates at the polling places, and there are also voter hotlines, like the Lawyers Committee has an amazing hotline that you can call if you see any of this kind of activity. And, you know, if it does arise, you know, local law enforcement will be called, as they were in Florida, as I understand, from the incident that you mentioned. And I think this will just have to be dealt with on a case-by-case basis as it arises.
Great, thank you. And the question is, will my vote be counted? So we have a huge, as you mentioned, huge turnout in vote by mail absentee ballots. And then we're seeing some legal battles over the deadlines for receipt and for counting of those.
Yeah.
So what does the landscape look like for that? What are some of the battles that are kind of going on right now around when to count these ballots that come in, and should voters be concerned?
Yeah, so a lot of voting rights advocates have been worried about absentee ballot deadlines because they're worried that the mail isn't potentially going to deliver ballots to voters quickly enough, particularly those who unfortunately delay in requesting an absentee ballot. And there's also been concern about, particularly in states that have traditionally low volumes of absentee voting, ramping up and accommodating, you know, a much, much greater volume of absentee voting. And in those states, they may not sort of be administratively prepared to handle that higher volume, which can result in delays. And so we saw this in the primaries, like in Wisconsin, where a lot of voters hadn't received their absentee ballot by Election Day. And so, you know, the concern was, you know, we need to accommodate these voters because of these extraordinary circumstances. So voting rights advocates have been pushing for accommodations, both just directly to election officials and also through litigation. And the success in doing that is quite mixed. So, for example, in Rhode Island, a case went all the way up to the Supreme Court about the witness signature requirement, the claim being that if, you know, in a pandemic, it's not safe to ask people to find someone to sign their ballot, so that should be waived. And Rhode Island officials were on board with waiving the witness signature requirement, and when it went to the Supreme Court found that that was fine. But there's been other instances where even the courts and the Supreme Court have denied, the federal courts have tried to make accommodations for voters that are in conflict with what state officials want. And in those cases, typically, the Supreme Court has not been willing to allow federal courts to step in and make changes to how voting happens in states. So it's been kind of a mixed bag. And in terms of the question about sort of how this is all going to go down, you know, again, states that don't have traditionally high volumes of absentee voting may find challenges in processing and counting those ballots. And I'm sure a lot of your viewers have heard that in some states, like particularly Pennsylvania, state law doesn't allow them to open the ballots and begin processing them until Election Day, which means there's a whole process that you have to go through before you can count an absentee vote. So you have to confirm that the person is eligible to vote. You have to check that they followed all of the instructions. And then you basically, once you've determined that the ballot is eligible, you remove it from the secrecy sleeve and you put it in a pile to be counted. But all that takes a lot of time. And if you can't do that until after Election Day in Pennsylvania, that means that it's just going to take a long time to count all those votes. And if there's a high volume of those votes, it may be quite some time before we know the results in Pennsylvania and several other states who are similarly situated. So I think the bottom line is I think people should be prepared to sit back and have a cup of tea and try to, you know, take deep breaths, because I think depending on how close the election is, it may take a while to sort out who won.
And taking a lot of self-care during this next couple of weeks.
Mm-hmm. That's what.
So going back to following ballot instructions, which you've mentioned a couple of times. So one of the challenges for vote by mail, of course, is that your ballot will be rejected. We know that people of color, in particular, have a higher ballot rejection rate than non-people of color. And one of the challenges is like voter misinformation or disinformation campaigns. So, you know, what kinds of disinformation, you know, are out there, and what can we do about that?
Yeah, this is a problem that predates this election. You know, we've had problems where, for example, there'll be robocalls in minority neighborhoods saying, you know, if you're a Democrat, vote on Wednesday instead of Tuesday. I mean, there's just been a lot of documented incidents of misinformation targeting minority voters. And that's, you know, illegal, and, you know, it can be prosecuted. And, but of course, the problem is that that doesn't stop the harm from, you know, impacting any given election. So this is a huge problem, and I think the problem has only gotten worse in our information environment, where information moves so quickly and is so hard to it's so hard to counteract. There are, you know, I think state election officials are taking this really seriously, and there are really interesting examples of state secretaries of state, for example, in Colorado, doing counter misinformation sort of moves, like making Google ad buys to like displace misinformation and correct it with corrected information. And so I think some jurisdictions, some states are starting to wise up to ways that they can counteract this problem, but you're right, it is a really big problem and something to really keep your eye on this election cycle, and make sure that you're not spreading any inaccurate information. So for example, like suppose someone sends out a tweet saying that there's been a bomb threat at a polling place. If that's not true, right, if there is no bomb threat, that can do a lot of damage if people retweet that or if people pick that up and it's not true. In other words, you can be part of the solution by making sure that you're not spreading information that you haven't confirmed is accurate.
So I'm going to pivot for a second to a topic of personal interest to me, and I think of personal interest to you as well, which is I'm based here in Florida. We have a recent report that about 67,000 returning citizens are able to vote in this election due to the efforts of the Florida Rights Restoration Coalition and partners. And DC, we know, have taken steps to make it easier for people with felony convictions to vote. So where is this battle over disenfranchisement heading, and will this have a significant impact on the 2020 election?
I think there's no question that if it comes down to Florida, it could very well have a significant impact. I think the estimates I saw for Amendment 4's impact was something like 1.4 million voters. You know, and just so your audience sort of knows the story, what happened is voters, by an overwhelming percentage, I think it was like 67%, voted to allow people or remove the restriction when people had been convicted of a felony that they not be able to vote for the rest of their lives unless they essentially received kind of a pardon, or not a pardon, but they were allowed to vote by the governor. And that the process for getting your right to vote back in Florida was incredibly restrictive, so very few people were able to get their right to vote back. They have a lifetime prohibition the second you get convicted of a felony. And so when the voters passed Amendment 4 in 2018, you know, that, as I said, estimates were that allowed 1.4 million people essentially to register and vote. But the legislature, working with the governor, decided that the phrase "complete your sentence" in the amendment itself had to include payment of fines and fees. And so that went up to, they got an advisory opinion from the state Supreme Court, and then the 11th Circuit weighed in very recently on that question and found that, in fact, that was a constitutional reading that did not violate the Constitution to require the payment of fines and fees. And the problem, the problem when you do that is that Florida doesn't have a centralized database that includes information on who owes what in their criminal fines and fees. So you have a lot of people who finished their sentence but were unable to determine whether or not they owed anything, and if so, how much, because they would have had to go, you know, to each of the 67 counties in Florida keeps tabs on this, and some better than others. And so a lot of people were just in the dark. They couldn't administratively figure out how much they owed. So I was buoyed to see that 67,000 people were able to figure out how much they owe and pay those fines. But they're in a pretty precarious position because, you know, if they're wrong or if the record keeping wasn't accurate and they vote, you know, could they be prosecuted? I mean, I think the whole situation makes it really hard. On top of which, I think the governor recently decided to try and take people off the rolls if it could be shown that they still owed fines and fees. So there could be a lot of confusion on election day when people show up thinking they've paid their fines and fees, but having been removed from the rolls. So this is a very long-winded way of saying, let's hope it isn't close in Florida, because it's going to be a very ugly, it's going to be very ugly as officials sort through who's eligible to vote and who wasn't.
Speaking of things, something along the lines of the 2000 election this year.
Yeah, so, I tend to agree with people who think that, 2000 was a real anomaly. There were so many different things that had to happen in order for the 537 vote margin in Florida to decide the presidential election. And so the alignment of stars that happened in 2000, it would be pretty extraordinary if it happened only 20 years later again. Lightning doesn't strike twice. That said, it's all just going to come down to how close this election is. And if it's close, it will be ugly, potentially, along the lines of a Bush v. Gore, as lawyers fight over which ballots to count after the election.
Have you seen positive changes in voter suppression? For example, are people mobilizing to enact long-term change to protect the vote?
Yeah, so I think that state legislatures and voting rights groups are going to spend time unpacking what's happened in the last 7 or 8 months in terms of how accessible our voting system is, how election emergency laws, state of emergency laws in states impact elections. I think there'll be a lot done to reform those aspects of the process. Unfortunately, our country is locked in a political battle that has one side sort of concerned about voter integrity and the other side worried about voter access. And so it's sort of like whoever's in political power, follows those agendas depending on, what they can get passed in their state legislatures. And so what's really unfortunate to me is that I don't think it's an either-or proposition. I think you can have accessible elections that are safe and have integrity and are fraud-proof. And so I hope that someday we get to a point where we can all collaborate on making elections secure and also accessible to everybody. But I think unfortunately where the political lines are drawn right now, that doesn't seem to be on the horizon.
So I think we'll give you one more question from an audience member, and then we know you have to take off. So have you seen evidence of state agency actions or state court decisions that use public health concerns as a rationale for reducing access to polling locations or otherwise making voting more difficult? And I think there may be a couple of examples of that.
Let me think about that. So the question is using public health rationales to prevent. Well, it's sort of the opposite, right? Like they don't believe that people under 65 need more accommodations. In Texas, so it's exactly the opposite, actually. And unless I'm misunderstanding the question, the times that I have seen efforts to use public health data to change how voting happens is to try and accommodate more voters during the pandemic. So plaintiffs, for example, who wanted to allow people under 65 to vote by mail in Texas, or plaintiffs who wanted to prevent the lack of a witness signature from disqualifying a ballot in Rhode Island and South Carolina and other states. They use a lot of public health information in their complaints to sort of document how real a burden this is on voters. And without getting too specific on the legal test involved, plaintiffs have to show that the burden is high. And so public health data can really help show that. And it's been successful in some instances and unsuccessful in others, as some courts just have not been sympathetic to voters who express concerns about voting during a pandemic.
Any other words of wisdom about this year's election?
The only other thing I guess I would say is that just to so that your audience knows, if there are disputes after the election, our country has had, decades and decades of experience in every election with post-election disputes. Judges know how to weigh evidence. If there's no evidence, judges won't find or disqualify ballots. And I think there's a lot of concern that post-election litigation means sort of the end of the world and that we'll be thrown into chaos. But I hope that people realize that post-election litigation is routine. Judges will weigh evidence if it comes to that, and if the evidence is there, they'll take action. If evidence isn't there, then it will be sort of a nothing burger. And I just think everyone needs to be patient and let the process work itself out.
Great work, Ellen. We're so happy that you could be with us today, and thank you for your patience with my terrible internet.
You're fine. We got through it.
We have Dr. Ellinger, and same thing, folks. If you have questions, feel free to start popping them into the Q&A box or to the chat. I can see them both, but it helps if it's in the Q&A because it nicely calls them out for me. But the first question for you both, first of all, thank you for being here today. And second is, why is this issue of voting and health equity important to you, and how did you get involved in this work?
Well, Dawn, I'll start. Thank you for the invitation to be a part of this. And I'm not sure my internet is any stronger than yours, so I hope we can get through this well. But I'm a physician, and when I first started in clinical practice, I realized as good as medical care is for treating illnesses and injuries, and could prevent some things through immunizations and screenings, it really wasn't as powerful as the lifestyle choices that people had and in impacting their health. And then so when I got involved in public health, I realized that lifestyle choices are actually influenced by the social norms in a community, the living conditions in a community. And those are the things, those social determinants of health are the things that really impact health. And what do you think makes the biggest impact on some of those social determinants of health? It's the policymakers at the federal, state, and local level who are put in place by elections. So I think that voting is one of the major public health activities we have. It improves the collective health, or has the potential to improve the collective health. And not only by electing individuals, but by voting, it actually gets people engaged in their community. It gives them a sense of belonging, which we're finding is one of those determinants. If you feel like you're part of the community, that you have some collective responsibility to the community, it makes you a better citizen. So that's how I got involved in it, was to truly try to address those social determinants of health and empower the communities and build power in communities so they can actually impact those policies.
And I'll just say ditto to that. And again, I'll say thank you for having me. I am also, I'm a public health practitioner and a self-proclaimed pracademic. And so I think my interest in this space is very similar to Edward's in that, really the social determinants of health are really the drivers of what makes community healthy and what creates and leads to health equity or health inequity. And our engagement in the political process is really the pathway that determines the impact of those social determinants. And so I think the more we are involved in selecting leaders who understand the importance of their role in creating a just and equitable society, the better off we all are. I think, the decisions around shaping the social determinants are really critical. And our ability to vote and engage in the political process is really what can help either both keep us where we are and sort of reinforce the status quo, or provide an opportunity for us to shift and really transform those systems and the environment that creates a healthy community.
And let me follow up with what Dana was talking about, that the people who've been most disenfranchised over the course of the year are the people who are most negatively influenced by the social determinants of health, Indigenous folks and people of color. And so voter suppression has impacted them more than ever. So if we're really going to deal with health equity, that's why we really have to increase access to voting for everyone, and particularly BIPOC populations, and make sure that they're secure and safe, because we're also finding in this terms of the pandemic, they're also the groups that are most impacted by COVID. So voting in this day and age is really a health equity issue.
What are some examples of how either a past election or some kind of law or policy has influenced one of the social determinants of health, for better or for worse?
Well, I have two examples that I use. Most of my work is in the maternal and child health area. And this year we're celebrating the 100th anniversary of women getting the right to choose, the 19th Amendment. And when women got the right to choose, right to vote, when women got the right to vote, the maternal mortality rates dropped precipitously in the next year because the policymakers at the federal level wanted to curry the favor of the women voters, and they passed the Shepherd-Towner Act, which really impacted maternal and child health services. It helped set up vital record systems in every state. It set up home visiting. It actually started, that was the first time we had federal government funding things at the state and local level. So when women got the right to vote, it had a huge impact on health. Then in 1965, when the Voting Rights Act got passed and enhanced the ability of African Americans in particular to go to the polls and vote, the infant mortality rate again dropped and the disparities dropped. So there are some and some legislation was passed in response to the expanding voting to people of color. And so those are two very specific examples where health impacts were because of an expansion of voting.
I would just add to that sort of the Affordable Care Act and sort of the processes that took place to build the momentum for support of the Affordable Care Act, which built on years of advocacy and support to expand healthcare and really around this generation of the idea that health is a human right, which is something still up for debate in some circles. And so I think there are very distinct ways in which we have used policy avenue to support the expansion of access to health and healthcare that has resulted in greater access for both marginalized communities, but all communities in general. But I also want to note that at every turn where we've implemented policies that have been support of or where the voters have expressed their desires for expansion of access to healthcare and health services, there have also been significant pressures in opposition to those measures. And so I think voting gives us the opportunity as a community collectively to move our values forward, which then ultimately lead to improved health for all populations.
I wonder if one or both of you have thought the states that have refused to expand Medicaid, something like 60% of those populations are people of color. And so sometimes these are voter-driven initiatives when state legislatures have chosen not to act. And, what does that mean for states that have still not expanded Medicaid?
Well, I would just start by saying I think it's not too late. There have been several studies that have come out very recently around the important role of Medicaid expansion in that we're actually seeing population health improve in those states that did expand Medicaid. And so I think there's evidence and data to support this policy decision has had real life implications on collectively on state health and on population health. And so I think that it's not a lost cause, and that there are actions that we can take collectively to continue to put people in positions of power that can make decisions that move our communities forward health-wise. I don't know, Edward, if you had something you wanted to add.
Yeah, Don, this is a perfect example of why voting is important. The states that have a higher percentage of people voting are healthier states. And the states who have a higher level of people participating in voting actually have more expansion of Medicaid because they voted in people who would be supportive of expanding access to health care. So these policy decisions are directly related to voting. And so that's why the more people we get to vote, the more the voices of the people are going to be heard and will influence policy decisions.
So I'd like to dive into a little bit more about what are the barriers that both people, organizations, maybe agencies are facing in turning out the vote, or as individuals getting out to vote? I know, Professor Rice, you work with incarcerated on issues of incarceration. You know, what are these barriers, and you know, are we addressing them for this election, or do we need to think about a longer-term strategy? Both of those things.
So I would first start by saying I think we need to think. We always need to think about longer-term strategies to figure out the ways that we can provide the most access to the most people to be able to participate in the political process. In my experience in working with those who are incarcerated, you know, there are some states and some actually local municipalities who are making decisions around how to engage people who have been incarcerated, as you just talked about in the earlier segment. But a lot of people aren't aware that, for example, people who are incarcerated in jail who have not been found guilty still maintain the right to vote. And so, but what that means as far as implementation is that there has to be some very explicit efforts, for example, to ensure that those individuals have access to register to vote and actually vote. And if those measures aren't taken in that community, then those people are disenfranchised from the process. And so you have to have very progressive thinking folks in power that are willing to maybe identify social workers to go into facilities and help people register to vote to make sure that they have the ability to exercise their vote, their vote. So I think, but what we've known historically is, as I mentioned earlier, is that we have seen efforts to discourage people from engaging in the political process through a variety of approaches, including gerrymandering and redistricting measures that have really negatively impacted communities of color. And so until we get to a space where we make the voting process much easier and less prohibitive and increase access, I think we continue to need to push forward, you know, the fight to make sure we're reaching as many people as possible.
And let me follow up on and expand what Dana was talking about. I think we have to take a broader view, a little higher level view, to recognize that the structural racism that we have in our society has been behind a lot of the efforts to disenfranchise folks. And we know that this has persisted forever. I mean, through Jim Crow, and certainly even since the Voting Rights Act of 1965, the efforts that have been put in place, the gerrymandering, the making it difficult to vote, the voter ID level requirements, all of those kinds of things are really particularly targeted at keeping people of color from voting. So we have to recognize that. So that is one of the efforts that we have to say ongoing. How do we address the structural racism in our society? And it gets played out in a whole variety of ways. And so I think one of the nice things, one of the good things that has come about after the aftermath of George Floyd's murder is that we start to recognize, oh my goodness, there are some really basic racial injustices going on, and people in all communities are starting to address those in ways that are unique to those communities, but are ways that we have to really put together to actually get people to vote.
And I just want to add to that I think it's important to also recognize that the sort of enlightenment that has happened since this summer and all of the racial uprisings has been enlightenment for certain communities. It's been very apparent in other communities for centuries. And so I think that there also needs to be this reckoning and a conversation that occurs and acknowledges sort of the historical systemic racism, an acknowledgement that has existed, an acknowledgement that communities have been working against these forces for years, and then working with those communities to figure out ways to expand their participation in this process, right? We can't just approach this as sort of this is a new era that we're all just now coming to realize this is the state of the day that we live in. This has been historically happening, continues to happen, and we have to make a more concerted effort to recognize the role that communities play in helping to both elevate themselves and also and be true partners in this process.
And I know we have over 150 participants on this call, on this webinar, and many of them work for organizations. And I'm hoping that they're in their personal organizations or agencies, they're working to also expand, diversify their workforce, but also to engage with communities, particularly underserved communities or disenfranchised communities. So just empowering, building power in the communities that you serve is also helping then to empower the voting. So what you do in your agency actually has a broader impact in your community, and particularly it will impact voter enfranchisement.
Do you have some, either one of you, specific examples of how communities can be engaged?
Well, certainly when I worked at the state health department, I was the commissioner of health for the state of Minnesota, we really looked at all of the ways that our policies did not empower communities. They were actually structurally disadvantaged populations of color and American Indians in particular. And so we changed how we did a lot of things. So even how we put together a health equity report, talking to the community first, getting their voices, then writing the report, and then bringing it back to the community to say, did you hear your voice in this report? And if they didn't hear their voice, rewriting it, just changing how we actually do our work. Similarly, we were really focusing on radon as a big problem in Minnesota. And so we targeted our work to homeowners and all of our educational materials to homeowners, not recognizing that African Americans only own, 21% of African Americans own homes, while 75% of whites own homes. Therefore, that our approach was really structurally racist. And so changing that and actually working with the community on how do we change the approach that we take. And that really changed the dynamic between the state agency and communities of color in the state of Minnesota.
So I think what Edward described is an excellent example. I think your example of participatory budgets is also a really great example. I think in general, what we need to do, especially from a health perspective, is really think about the ways in which we move to a more power sharing approach. And that can be very challenging to sort of the existing way we've been doing work. And so it's about not doing public health on community, but doing public health with community in true partnership, which means that our priority setting may not be our priority setting, right? It should not be centered based on what we see as sort of an agency or an institution. It should be what the community tells us is the priority. And we should come into these relationships in a consultative role to support the work of sort of improving the lives of our community. And so it really causes us to shift the way that we think about the way we've been doing work from a more top-down approach to a real engaged partnership approach. And so I think there are a lot of ways we can go about doing that. Edward described several around sort of engaging community in the process. I think that needs to happen very early on before we even set agendas. I think if we're going to center our actions in equity, it means we also have to use our data to inform our decision-making around who we know has most been disenfranchised and most affected by these social determinants of health, right? And so we need to start there around really targeting our efforts towards elevating those voices who have been most left out.
The other thing that I think is really effective is actually changing the narrative in a community about what creates health. Most people believe that it is just medical care and personal choices. They don't understand the idea that it is the social determinants of health that really impact health, and that the communities have an impact on changing those conditions by building power in those communities. So once we change that narrative, community organizing then becomes much more powerful, and people get engaged in community organizing, which then can change how agencies and organizations function and how politicians function. So, and those of us who work in agencies recognize the power of community, and we can actually say, let's have an inside game and an outside game. Let's work with the communities and have the communities develop the power to actually force us to do what we already want to do. And a lot of times, I think public agencies want to do something, but don't feel empowered to do that until the community says, you better do that because that's your job. So it's that inside-outside game, and community organizing is a real public health tool, and it has to be built around changing the narrative about what creates health and letting communities recognize that they have the power to influence policies at the state, local, and at the federal level.
Yeah, I would also just add to that the important, narrative is critically important as we think about sort of what we think about defines health. I think what that does is it elevates the fact that many communities have been surviving and thriving in spite of all of the political decisions that have been made to keep them back. And what we need to do as public health practitioners is outreach to those communities to really elevate what those stories are, what that looks like, because communities have been able to maintain some, levels of health and wellness and well-being. And so we need to expand our view of what it means to be, what it means to a community to be healthy. And in turn, that's how you sort of elevate the new narrative.
I also think we need to change the narrative about voting. I mean, part of the narrative is, my vote doesn't count. My one vote doesn't count. It's all rigged. Voting is only for white people. Voting is dangerous. Voting is, I don't agree with all of the people, so therefore I don't vote. Or there's a whole variety of narratives that discount the impact it has. And so we have to change the narrative about this is a community action, that this is not just about your individual needs, it's about community's needs. It's about everybody has the right to vote. It's about a way to be engaged in the community. So I think there's some work that needs to go on about the narrative that needs to be ongoing.
I wanted to go back to Dr. Ellinger. You mentioned the word tool, and there's a question in the chat, and please, folks, enter in the Q&A box. But Dr. Ellinger, how did you identify which policies were harmful that you were talking about? And maybe more generally, what are some tools for communities or public health professionals to identify the impact on equity in policy?
Well, I think we have to relook at all of the policies that we put in various agencies, because those policies have been built up over the years, and they've been put together by people in power, and the people in power have usually been the white community and people with resources. And so I think they came into being with that whole idea of the white gaze, as so to speak. And so I think we have to really look at all of them to see, actually, are they having an adverse impact on certain parts of the population? Looking at our zoning ordinances, for example. Our zoning ordinances were put in place for a variety of reasons, but many of them were to keep low-income folks out of certain neighborhoods and the kind of homes that would be built. Certainly, the redlining is a good example of how to get mortgages or not get mortgages and disinvest in communities. Even looking at transportation policies, for example. One of the examples that often is used is that bus lines coming from the suburbs into the city, by the time they reach the city borders, the buses are full, so the people who actually in the city can't get on the bus because they're already full, and so they have to wait for the next one to come. Just setting up policies about how to move people oftentimes disenfranchise folks, particularly low-income folks and people of color. So I think you have to set up a way of looking at every single policy to see if it impacts any population negatively, because it's about social justice. Everybody gets to have their basic needs met, and nobody should benefit at the expense of somebody else. And so you look at all of those policies with that frame.
I'll just add to that I think, one of the key tools in doing that is a health impact assessment, which is really a sort of a stepwise approach to judging how to understanding what the effects of policies and programs are on the health of vulnerable communities. And I think there are several organizations that have even shared human impact partners based out of the San Francisco Bay Area is an organization that's been doing a lot of work around supporting local health departments to do health impact assessments to understand what policy, what the direct impact is on health of policies and programs on community health. And so I think that just ties nicely to what Edward talked about.
So one of the questions in the chat box, shouldn't we begin to educate kids in school on the key public health civic elements that are needed rather than wait until they are adults?
Short answer, yes, absolutely. I mean, I think we all need to develop a better understanding collectively of what health is, and what it takes to create healthy communities. And the earlier we're all engaged in understanding all of the components of what makes a healthy community, the better off we'll be, and the more empowered we are to make decisions towards creating the environments that lead to those healthy communities. I think to Edward's point earlier, the term social determinants of health has been around in our field for quite some time, but it has only recently sort of seeped into sort of the common language, and where people are still trying to grapple with not only what are the social determinants of health, but how can we do something about it? And I think the more of us that are educated around these are the conditions where we live, love, work, play, and pray, and those have a much greater impact on our health outcome than clinical care, than access to clinical care do per se, then we'll have more folks in the fight to help us sort of shift the needle and make positive policy change.
In my clinical days as a pediatrician, I would ask 4 questions of parents for every well-child exam. Does your kid know how to swim? Does your child have a library card? Have you visited the state capitol in your state, and have you registered to vote? And so parents are like, I understand, the swimming thing, that's a life-saving skill, and yeah, I can understand the library card because education is linked to health. But what does visiting the state capitol and my having the right to vote, being registered to vote, have to do with health? Started a conversation, and I think this is the conversation that needs to be ongoing. It's not, that people talk about how this is the most important election, ever. I'm sorry, every single election is important because the issues that we're dealing with today were created by policies made 20, 30, 40, 50 years ago. So it's a collection of these policies that have built up over the years. So every single election is really important, and we need to identify for children that this is a lifelong activity of being engaged in your communities, and voting every 2 years or 4 years, whatever the times are. Voting is one part of being engaged civically. So I think the earlier we start with civic education, the better it is.
I think we lost Don again.
All right, so Dana, what point do you want to make?
I'm happy to take over. One of the and I'll just keep going. I think one of the things as we talk about sort of expanding our knowledge around how policy impacts our health, I think there's been a wonderful book that recently came out by Daniel Dawes called The Political Determinants of Health. I'm not finished with it, but I highly recommend it because I think it very nicely articulates the importance of voting and how all of these, the political determinants really underpin the health of communities and how we end up, thriving and surviving in this world.
Yeah, I agree. Yeah. The other point that I made, I talked about the fact that, people say this is the most important election of our lifetime. Well, and I disagree with that sort of, maybe one more important than ever. But this is really important this time for a couple of reasons. I think COVID and the racial injustices that we're seeing and the economic collapse has identified that we have some huge problems in our society. We have problems with our medical care system. We have problems with our public health system. We have problems with our education system. We have problems with our economic system. We have problems with our political system. And so I think people are now aware that we need to make some huge changes in terms of access to care, how we invest in public health, how we do education, how, all of these things. And they're recognizing that whoever gets elected in the next legislative session at the state level or in Congress is going to have some huge decisions to make. So the stakes are really high because of what we're seeing because of COVID and the racial injustices, uprisings that we've seen.
I could completely agree. I also think what COVID has done, I mean, when in public health conversations, we often talk about how COVID has illuminated all of the inequities that we've been reporting on for years, and it sort of brought all of these disparities on full display for all to see. And so I think in addition to sort of the importance of this election being a really important election, I think public health is so much on the ballot to the point of this webinar in ways it has not been at the forefront before, in that people really recognize the important role of public health, right? Because when we're able to do our jobs well and our jobs are fully funded and supported, we're able to thwart pandemics and local epidemics. And when we are under-resourced and are forced to work in silos, it inhibits our ability to then make decisions around creating healthy communities. It inhibits our ability to collect accurate data and to be able to report and share that data. It inhibits our ability to make decisions around implementing policies and strategies that keep communities healthy. And so, I would completely agree that every election is critically important. And I would also say that this election is also important not only at the top of the ballot, but all the way down the ballot, right? Because most of our lives are experienced at the local level, and decisions that are made, local policy really impacts our daily life, right? And so if we're not conscious and aware of who's running for sheriff or who's running for district attorney or who's running for those positions or mayor or your city council member or your, a superintendent of education, right? If we're not voting in people who support and value equity and justice and recognize how we're all interconnected, then we are, of course, then doing a disservice to the rights that we've been given. So.
Yeah, and it's not just the elected positions. By voting, you actually become more civically engaged in all sorts of things. People who vote end up being on committees, on task forces, on work groups, are actively engaged. And it's those things that certainly build community power that then influence the policymakers. And the policies are not just public policies. There's policies that are involved in your local soccer team,
right.
Your Boy Scout, Girl Scout troops. There are policies certainly at the school level and at the city level. And then businesses have policies. And so you can have an impact on all of those policies if you're engaged in a real proactive way.
Absolutely. I wish we could see if there were questions in the chat, and I'm not sure if our host is able to do that. I see Dawn is still having some technical issues getting on, and I'd love to chat with you for another 30 minutes. Well, you know what, Edward, I have one for you because we talked in our planning sessions. There were a lot of questions that we talked about. Maybe we can go from there.
Yeah.
And so one of the questions that I'd like to have a conversation about, just sort of given the work that I do and given your work as a state health director, is normalizing conversations around racial disparities and health outcomes. So one of the questions was, how do we do that as individuals, as public health professionals, and institutions? So what are your thoughts on that?
Well, I think that goes along with the narrative discussion. What creates health? And certainly when we looked at the data and we looked at what was going on in our communities, we noticed that Indigenous populations and populations of color were disadvantaged because of the policies, and therefore the disparities that we have in all sorts of health outcomes were because of structural racism. So just by changing the narrative, by looking at what creates health, we then start to see, we have to deal with the disparities, and we have to deal with the structural racism that's behind it all. And so just looking at that, and then that changes how we look at data and how we look at program development and how we set up our policies. All of those things really revolve around by normalizing a conversation about what creates health, as opposed, in the social issues in particular, not just the access to care issues.
Yeah, I think one of the things that we also need to think about is that we also tend to have a very deficit-oriented conversation, thinking about disparities. And I think what's important in helping to shift the conversation would be to center our comments, to center our language around creating systems that generate equity, rather than have the deficit orientation around disparities, right? Because disparities is really just a measurable difference between two groups, whereas what we're really looking to achieve is systems that create equity. And I think that there's less pushback when you frame, when we alter our framing of the conversation around achieving equity. And there's greater acknowledgement that, yes, we're seeing these differences, and the end goal or the end game is to achieve equity. And so I see that there's been Charles has said that there's some questions in the Q&A. So maybe I don't see Dawn anymore.
Yeah, it looks like Dawn disconnected. So I'll just jump in and ask some of the questions that came through. So one person asked, organizations that have not typically engaged communities, what are some good first steps for making those connections?
Well, I would recommend being humble and going out as an organization to the community and acknowledging that, and asking to engage. I think the first part is really about building relationship, right? So community engagement starts with relationship that should not always be situated around a crisis or when there's a moment of need. And so these relationships are built and strengthened based on longevity and based on honesty. And so I think as institutions, if we approach community by honestly both reflecting why there hasn't been that engagement in the past with the intention of moving forward in partnership, then I think that helps to establish connections between, community organizations and institutions. I think too frequently in the past, institutions have made decisions without even acknowledging community's role in their environment, right? And so I think that we have to sort of shift the way we're thinking and really move towards this power shared approach by reaching out to community early and reaching out to them often. And so that would be my recommendation for how to do that.
It really revolves around, again, I come back to the narrative piece. The narrative in our society is one about individual responsibility. The rugged individual is all about the individual person. And so I actually argue against, in the medical care world, person-centered care. It should be community-centered care, because people can only be healthy in relationship to their family, in relationship to the community, in relationship to their neighborhood, and their community, however it's defined. So just having that mindset when you, as an organization, as an agency, change the mindset from let's focus on the individual and the individual's needs to focus on the individual in a community. And that changes how you collect your data. It changes how you set up your policies. It changes how you change your services or deliver your services. And so just that mindset is the first step that has to be there. And then, certainly we have to recognize that there's power in the community themselves. It's not just the service organization that can provide, the needs for the community. The community has some say in how those are developed, how they're provided, and how they're evaluated.
Another question was, how has or how can technology positively affect health outcomes for marginalized communities?
Well, I think the internet broadband coverage is actually one of the social determinants of health. And that is one of the things that we have to recognize is that, and these are where policy is coming, how do you get broadband throughout the community? And we're just seeing now, if you have good internet connection, you can get some education. If you don't have good internet connectivity, you can be left out. And we're thinking that we, in this digital age, it's increasingly important. And so just like what we've done with Get Out the Vote, for example, some of the community organizing couldn't be door to door because of COVID this year. So we're having to use digital means, social media mechanisms of getting people organized. and we're learning how that gets done. We're learning that it's actually different in different communities, and urban communities, rural communities, communities of color, low-income communities, higher-income communities, all have a little different mechanism. So I think we have to recognize it's a complex area, but it's increasingly important, and we will learn as we go along. And we should always learn with that equity lens. Are we leaving anybody out? Is anybody being disadvantaged by the decisions that are being made?
And just to add to that, I think COVID and everyone shifting to sort of this online virtual space has really illuminated that the importance of technology and widespread universal broadband access for communities that are both in urban settings and rural settings. This has become a real issue of health equity, in that there have been numerous communities that have been left out of being able to just participate and engage in schooling, right? Because they don't have equitable access to the internet. And so I think as we think our way around managing through a pandemic, and we also, thinking about how a lot of our systems will be changed forever moving forward, just based on what we've learned around what we can do now virtually versus what we thought we could only do face to face. But we can only do that if communities have equitable access to technology. So I think that needs to be a continuing and ongoing conversation. I also just wanted to add, sort of separately, noticed someone in the chat had asked a question about the organization that I mentioned that's doing work in the Bay Area on health impact assessments, and that's Human Impact Partners. So, and I'm happy to put their information in the chat for those who need it.
Yeah.
Can you hear me now?
Yes.
Okay, so this is when you know you have a good panel, is they don't even need a moderator. So I think this is great. So Charles, stay on backup just in case, and please send in additional questions. I think there's been a lot of great, just really amazing information, lots of stuff for us to think about and tools to look for. If you're talking to your friends or neighbors, what is your takeaway message this year for this election?
Well, there's a lot of takeaway messages from a lot of areas, and I want to make one point. You'd mentioned that one of my roles is on the board of the Langlot Foundation, and it's a foundation that has been spending money on the area of criminal justice reform and community violence prevention. And they recognize that civic engagement actually impacted those two areas of their focus. So they actually added $20 million of their funds to voter engagement, voter safety, get out the vote activities, recognizing that it impacts their broader mission. And I think that's what we also have to do with other funders in the philanthropic space, is to recognize voting impacts every single part of the public health agenda. And so we need to invest in this on an ongoing basis. And so that's the other thing in terms of community mention, is that we have to build civic engagement, civic participation on an ongoing basis. Got to do it this year, got to do it next year, the year after that. This can't just stop once this election is over. It has to continue. So actually looking at the funders and looking at public health agencies to say, make this part of your portfolio. It should be an essential part of your public health portfolio, ongoing civic engagement. I think that's the only way we're going to actually eliminate health disparities and advance health equity, is when we get everybody actively engaged in making policy decisions.
I would completely agree. When I talk with my neighbors, it's just really vote, right? I also agree that this has to be an ongoing conversation that needs to be integrated into our both public health agenda, but the agendas of philanthropic organizations. I think that we have to really reframe the importance of policy making and a political process, and make the connections between sort of the decision making of those who are in power in their ability to either reinforce the status quo or transform and imagine new systems. And we can't do that if we're not engaged in elevating our voices, because I think what ends up happening is on the community level, we're seeing the demand for change on the community level before it makes its way into the political system, right? So we're seeing the groundswell of what needs to happen and what needs to be improved, and how we're recognizing sort of how the policies have failed us as a community first. That happens in community first. And so if we're not sort of having conversation with community continually about how to create those healthy policies, those healthy environments, and only do it during sort of major election years, we're going to really miss the boat for making that transformation.
What do you think we need to do to keep the momentum going? I know I talk to people a lot about outreach, which is a year-long kind of process, or annual process, or a year-long process that gets voters involved in local policy activities, policy making. What are some other ways?
I think we need to engage and integrate young people into all components of this process, right? So I think the more young people are knowledgeable before they turn 18 and have the right to vote, I think it makes sort of our policies more forward-thinking as adult-age, decision makers. But I also think it helps us keep our agendas relevant and important and connected. And so I think it's critical for us to really expand our reach to include and integrate the voices of young people.
Another way of saying that is that our job should be to build community capacity. If we're not building community capacity with everything that we do, we're not doing the right thing. So we talk about, diversity and inclusion and equity and in hiring and having an advisory committees. It's not just having a diverse advisory committee, but are the people on that committee connected with their community? Are they accountable to that community? Do they have a base that they have to report back to? How do we build the capacity so that it's not just one individual at the table representing his or her own ideas, but actually is accountable to a broader constituency and has a base in the community that he or she has to report back to? It is that building capacity. And same thing with young folks to say, what do you do with your friends? How do you get them engaged in this conversation? How do you build, it's sort of like building a team. And I think that changes our mindset from individual to community.
So Charles, I don't see other questions in the chat box or the Q&A box. Do you?
No, I do not.
If you have questions, enter them now. And if not, what we'll do is, Charles, if you don't mind pulling up the slide, so we'll start
Definitely.
Our kind of wrap up, but we will take a question if one comes in, and to give our panelists an opportunity for any last remarks you want to give to the audience before we sign off. And my many thanks to you for everything that you did to be awesome today.
Well, there are two definitions of public health that I use. One is the Institute of Medicine definition, what we do collectively to assure the conditions in which people can be healthy. And that means voting is one of those major things that we do collectively to assure the conditions in which people can be healthy. The other definition I use is of Jeffrey Vickers, is that public health is a constant redefinition of the unacceptable. And voting suppression is one of those unacceptable things that therefore it should be a public health concern. It should be a public health issue to make sure that everybody gets to vote. That's why voting is a public health issue, both for us today, but for our kids, our grandchildren, and our great-grandchildren whenever they come around.
Thank you.
And I just want to thank you for the opportunity to share the stage with you all and for elevating this conversation to this level. I completely agree with Edward's both definitions of public health. I think now is the opportunity we have to put in place leadership that centers the values of community to create a healthier community for all, not just to reinforce where we've been, but to move us to a place of transformation and well-being for all. So thank you.
And thanks to you both. This has been a really dynamic conversation. I'm sorry if anything on my end took away from it. So I hope that the audience had just got a lot out of it, because I know I did for the parts that I was able to hear. I want to conclude by thanking ASTO, our partner in organizing today's webinar. And I want everyone to vote safe, which I mentioned earlier. You can link to this through ASTO's website. I mentioned the Vote Safe Coalition does a number of things, including encouraging voter participation on Election Day, but also coordinating and amplifying communications and education efforts, supporting efforts to recruit an expanded workforce of poll workers, which we know is really important in all states, and providing guidance and public health technical assistance to elections officials. You can also find out how to create a plan to vote safely in your state at healthyvoting.org. And finally, I want to mention, you heard Professor Green mention the Election Protection Hotline that is run by Lawyers Committee for Civil Rights Under Law. That is this hotline that's on the bottom half of this slide, 866-OUR-VOTE. I am one of the countless legal volunteers that actually volunteers to staff the line. It doesn't matter what the question is, even just how to find your polling location, or more serious issues like witnessing voter intimidation. Call the hotline, tell your friends about it. We want to make sure that people can vote and that they can do so safely and securely. There are also other voter protection hotlines out there. You know, they all serve the same purpose. So, you know, find the number that's relevant to you and use the resources that are most relevant to you in your community. So I also want to close again by thanking Charles for stepping in, and thanking my neighbor for the last minute internet connection. And I really do appreciate both Dan and Edward for really just being on this call today. I thought it was really great info, very dynamic, and I hope that our audience got a lot out of it. And I don't know if you want to take one last quick question, but one came in says, what light has COVID-19 shined on global public health practices?
Well, COVID identified the disparities that we have in our healthcare system, in our medical care system, in our public health system, and the inadequacies that they have. It is just a blatant example of the work that needs to be done to address equity in our society.
Completely agreed. And it also has illuminated our failure to really address the social determinants of health in a real meaningful way to create that equity that we need to see. So I think when we get when we wrap our minds and get a hold of COVID and we move beyond this moment, I hope that it encourages us to really center our conversation around improving those determinants of health.
And it highlights the fact that we have to change our priorities in terms of investment. We need to invest in public health, broadly defined, because that will help us with the medical and the health and education and economics. All of those things will be better if we invest in a public health approach.
And maybe one last one that just came in. How do we ensure Indigenous and people of color receive quality medical care, especially if they are on medical assistance or Medicare? That might be a long question to answer, but I'll let you address it if you want to.
Should we start talking about single payer?
That's definitely one of the options that's out there.
Healthcare is a human right, and we have lots of things that we have to do better in terms of our healthcare system, obviously. But just making sure we have universal access as a step in that direction it's unconscionable that we have as many people not covered by health insurance, and then unconscionable that they're treated differently in our healthcare system when they do get access. So it's a long conversation and an important one.
Absolutely.
So with that, I want to say thanks again. I'm going to turn it over to Charles for some final words.
Thanks, Dawn, and thank you to all of our panelists for presenting today and our attendees for your patience. Just a few final notes. All attendees will be receiving an email from the network with the playback of this webinar, as well as a link to our brief webinar survey. And that survey just takes a minute to fill out and provides us with some great insights, especially in regards to what topics you might be interested in for future webinars. And you'll also be receiving an email from ASL&E with information on how to apply for CLE credits for this event. So that concludes today's webinar. Thank you all for attending and have a great rest of your day.